So today's Cardinal lesson, we're going to talk about why is Medicare so confusing. And so if you're not confused by Medicare at some level, then this video is probably not for you. But I experience, and it almost seems like the more intelligent people are, the more of a problem solver they are, the more used to that they can take a complicated subject, study about it, read about it, talk to their colleagues, and then have their arms wrapped around it in a couple of days. Those kind of people, they end up in some weird places with Medicare, and perhaps this is you. So I'm going to venture into some area I don't usually go to in these videos. We're going to talk a bit about the word why. So we're going to ask, why is this so confusing? When I normally just try to unconfuse it and just explain it to you, and then more importantly, tell you what you need to do. So we're going to venture into why is this so confusing? And so let's just for a minute think about 2023. Right now, somebody who's turning 65, like me, they were born in 1958, and or maybe they were born in 1956, but they worked a couple of years beyond 65 and they're covered on group insurance. And so they're just now signing up for Medicare like they're turning 65. And it's just confusing. And so I'm going to just get into a couple things here. So you got Part A, which is hospital. You got Part B, which is doctor and outpatient, and really anything where you're not a bed patient in the hospital. And then you've got Medigap plans, which are called Plan A, Plan B, Plan C, Plan D, Plan G, Plan N. And they're to be different from parts. And then you've got Medicare Part D drugs coming out there, which are included in a Medicare Advantage Part C plan, but they're not included on original Medicare. And then in addition to that, you've got penalties for late sign up. Who wants a penalty? I mean, it's frightening. It's like a library fine when you were a kid. I mean, it's something you don't want. People don't understand them. They don't understand why they're there. And we're not going to give you the answer to all these. We've got videos after video after video on all of these subjects: IRMAA, penalties, original Medicare, Medicare Advantage plans. And most of our videos just give you the benefit of our experience, where we're going to just share with you, like, this is what you need to do about this, that, and the other thing. This video is going to get, how did we get to this place where you've got what should be a reasonably simple subject? It's that people 65 and over, how does their health insurance work? Part of it comes from the government. Part of it you buy from a private insurance company. It shouldn't be this way, but it is. It's confusing, and I'm going to try to share with you how we got here. So I'd like to go to the board, and I'd like to go to the when Medicare first started in 1966 and show you what we're talking about here.
Yeah, and so the show notes, what we're going to look at here in a second, is just a picture of the board with some other details. But for people who want to print this out, blow it up, look at it a little closer, I'd encourage that. You can find those in the link below of the video. But if we look at the details, if we look at 1966, which was the first full year Medicare was available, it was people 65 and over were eligible for. The Part A deductible was only $40. And so that's if you go to the hospital, you pay the first $40, whereas today it's $1,600. The skilled nursing facility cost was $5 after they will pay for the first 20 days, but after that it was $5 a day. That wasn't too bad. And then the Part B deductible is $50. One thing that has stayed constant through the whole Medicare system is that Part B coinsurance. That's the 20%. And that's really the area. That's why you need to do some planning around Medicare. That's where a lot of the liability comes in. The exposure for out-of-pocket costs is that Part B coinsurance. And that's been 20% from day one. And that hasn't changed. I will point out the premium for Part B back then was only $3, whereas today it's $164. So I mean, it has changed quite a bit there. But again, that was the first place. One of the things I want to show in the show notes, because those are sort of the details of what was in that, is we have a picture of when the bill was signed into law. I think they signed it in 1965 for taking effect 1966. But this is when they were actually signing it, and then the bill itself was much simpler. I mean, it was much smaller. We can see. I'll make this a little bit bigger. I mean, we had Part A listed with some descriptions of what that is, and Part B is a little bit lower here. Part B listed, and then the next page is the signature. I mean, you can see the signature of the president, Lyndon Johnson, and then some of the vice president, the Speaker of the House. But again, it was not as complicated. It was much simpler. The numbers were obviously much lower then, but this was what was signed, the copy of what was signed back then.
Go back to the picture, Tom.
Yeah.
So when this was signed in 1965, it was done in Independence, Missouri, because Harry Truman and Bess Truman, in the right side of the picture there, were the first two beneficiaries of Medicare. And Lyndon Johnson, was 58 at the time. He didn't even make it to Medicare. He passed away when he was 64. And back in those days, a lot of people didn't even make it to Medicare. I mean, people were deceased by this time. And most people, when they did make it to 65, were retired. So this program, and it says even back in that bill, it's for the aged. So I think if you called the people the aged today in time, somebody'd come after you with a pitchfork or whatever. But this was for older people and to make sure they don't go broke getting medical care. Okay. Now, I'm bringing up all this history because I want to show you, in which Tom went over, in the beginning, that's how the Bible begins, is in the beginning, the first year of Medicare, 1966, this was pretty simple. I mean, you had a $40 Part A deductible. So that meant you could go in the hospital for 60 days or 3 days, or it didn't matter. Your only liability, if you were on Medicare, was $40. So you take that $40, that's it. Okay. And if that's all there was to it, people wouldn't have needed Medicare supplement insurance. But then you had the doctor bill, even while you're in the hospital, and the doctor bill was Part B, still is, and the annual deductible was $50. Again, not too severe. I mean, it was a lot more money then than it is now. But the issue is Medicare only paid 80% of your charges, and you were left with 20%. And there was no cap on the 20%. And there's still no cap today. This has not changed in the 50-some years since Medicare came out, that you, the Medicare beneficiary, when you're getting charges under Part B, you're responsible for 20% of them. And you're also responsible if a doctor charges more than Medicare allows. If it's a doctor that doesn't take assignment, this has been around from the beginning. And so this 20% was then and is today the issue, is why you need supplemental coverage or something to go along with Medicare. But it was simple back then. And, so then we go to 1976. And what's significant about the year of 1976? That's the year when Hans was 18, got his insurance license, and started selling Medicare supplements to people 3 times his age. And I've been doing it ever since. And it was pretty simple then. We had a piece of paper, and on the first side of the piece of paper, we had Medicare Part A, Medicare Part B. We explained that the Part A was $104 deductible, which is now, by the way, $1,600 today, but it was $104 then. And the deductible for Part B had grown to $60, still not frightening. But what people were concerned about was the 20%. Is that they could have a large doctor bill, they could have an expensive surgery, and they would be responsible for 20% of it. And if they went to a doctor that didn't take assignment, they could be responsible for more than 20% of the excess charges. So that was the deal then. And again, pretty simple. It took us maybe 15, 20 minutes to explain the whole Medicare program to people, and then to another 5 minutes to sell them a Medicare supplement, and we were on our way. Okay. And then the years passed, and they really messed with Medicare and Medicare insurance in 1990. And so what you had here was the invention of Medicare 10. And what Medicare 10 is standardization of Medicare supplements. So you say, why does that matter to me? Now, the Medicare 10 law is still in effect today in 2023. Okay. And it did several things. It came out with 10 policies that are identical from company to company. And a lot of people in today's time buy the Plan G, the Medicare Supplement Plan G, and we have several videos on that, other videos. We'll reference them in the show notes where you can go learn about the details. But the point I want you to get is they name these things Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, and just so on. So they just gave them lettered names, which is the same as the parts. And that's where the confusion just started in, is that people today come back and they're just confused. They don't know the difference between a Plan G and a Part D and a Part B, and they're just in a tailspin. So anyhow, Medicare 10 came about in 1990, and to this day, you don't really need to compare the benefits offered by the different insurance companies because they're all identical. It makes no difference. Whether you buy your Plan G from Mutual of Omaha or Cigna or Aetna or United Healthcare, I mean, sure, they're different companies. They have different payment histories. You could have a preference, but the benefits of your policy and how it's going to go through automatic claim filing are identical. So there's just no point in comparison. The prices are different, so you can do some comparison shopping, but they really wanted to make it easier. And what I just want to note is 33 years later, and really all the time in between, this is still news to people on Medicare. They're just the same. They're identical. It makes no difference. If you buy a Plan G, you can buy it from anybody. It's the exact same policy. Then they also came out with what was called open enrollment. And what that means is it's all these insurance companies who offer these 10 policies from Medicare, they are going to ask you health questions. They're not going to let you buy a policy from them if you have a bunch of illness. They don't want a line outside their door of people buying insurance right before they go in the hospital. So they got a set of health questions. And if you have anything too severe, they're going to accept you. They passed a law in 1990 that says when you're new to Medicare and new to Medicare Part B, like boy, you have an open enrollment period of 6 months where these insurance companies can ask you no health questions. So you could actually be in the hospital and buy a policy and it goes in effect immediately. And a lot of people don't know that. There's a 6-month window of open enrollment. And that gets confused when people read about things. We're back to the confusing. This only deals with Medigap and Medicare Supplement. There's a 6-month window where you can buy a policy from any company that you want. Then they also put in the cap on the excess charges. So if you had a doctor who doesn't take assignment, so it's a doctor that says, I take Medicare, but I don't agree to work by their charge limits, they put a cap of 15% that this doctor can charge you over the Medicare approved amount. And then they made, in these Medicare 10, they've got about 3 or 4 policies that cover that. And the Plan G does cover excess charges. That's still true today. So I'm giving you this history because as they've messed with Medicare over 50 some years and they've created all these rules and regulations, it's a little bit like the tax code. When you sit down and you haven't been paying attention to it, you hadn't had any reason to pay attention to it, and now you're turning 65, this comes at you from so many different places, people are confused. And that's what creates a business for us is we try to help you and simplify the stuff. So the next topic where you go into is I go all the way to 2006, where there's 26 years. There's certainly some things that happen with Medicare during this, but I don't want to go over every fine detail. Just have the watershed years here. So we're going to talk about in 2006. That's when this thing just went over the top confusing. I mean, it's just, and that was the invention of Medicare Advantage. It existed prior to that, but not on a large scale. And it became Medicare Part C. And we have other videos that'll get into like what it is. You don't have to go on it, but you can go on it. There's some good reasons to go on it, but it added a huge amount of confusion because it's loaded with rules. It has an open enrollment period during the fall. That's when you see all those TV commercials. You just have a whole ton of rules and regulations. And what a lot of consumers do that aren't even going to go on it, they start applying all these rules of Medicare Advantage to original Medicare. And so it's nuts. And it started in 2006. They also started the Part D drug programs. And I was an executive with a major insurance company involved in this when this stuff was rolled out in 2006. And people have been complaining about it ever since. The drug program, and it is confusing. It's got the donut hole, and they call the coverage gap, and I have difficulty understanding it from year to year, but get my arms wrapped around it. And most consumers still don't understand exactly what's going on with the thing. But what I will tell you, the good news is before this, there was no drug coverage for people on Medicare. I mean, we were helping consumers in the 90s order drugs from Canada, over the internet or by mail order, just because they were so expensive here, they were less expensive there, and there was no Part D Medicare program. So before you start complaining about it too much, it didn't exist before 2006. This is the real watershed year where this stuff went, where people have a hard time with it. Then in 2007, 1 year later, they created this thing called IRMAA. We have other videos on IRMAA, and we can explain not only what it is, but we can talk about what you can do about it, how you can prepare for it, how you can appeal it, other videos. I just want to mention that it is the Medicare tax on the well-to-do that are on Medicare. I mean, it's just that simple. And it was not very penal when it came out in 2007, but it didn't take long. It's very penal today. And it's just another factor that confuses people. And then, what we have is now. And so we're sitting here in 2023. You're a person turning 65, or maybe you've been on Medicare for a while and you just didn't really pay much attention. You just signed up with something and it's kind of been going okay. And when you try to understand what's going on, you got all this stuff at work. And so now you've got a $1,600 per hospital stay deductible. But if you have Medigap or Medicare supplement, you don't ever see that because it's paid. You've got a $200 a day co-payment if you go to the skilled nursing facility after the hospital. Again, Medigap pays it. You got a $226 Part B deductible. You do see that because it is now against the law if you came on Medicare 2020 or after for us to sell you a policy that covers this. So the government mandated that a few years ago that said, you, the consumer, got to pay this $226. But the 20% is the same as it's been all along, and it's been the underlying biggest problem. It was paid by the Medigap policies then, and it is today. You just pay a lot more for your Medicare supplement policy today than you did then. The 15% excess charge is the same. And again, you don't have to worry about that if you have the right Medicare supplement. The Part B premium is $164.90 if you don't face IRMAA. If you face IRMAA, it's much more. And you go through this whole thing, it's crazy. And I don't try to make you like it. I did this video on why. Maybe we'll do one of these on the tax code, because the tax code was pretty easy when they came out with it in 1916. And then, over 100 years later, it's pretty, you could fill up this room with publications of confusion. Maybe we'll do that. But for right now, this is on Medicare. I'm just trying to give you some sense of where the confusion is. And my advice to you would be to simply wipe the assumptions you have away and meet us with an open mind, and just prepare to put your assumptions aside. And if I can start you from scratch, I can walk you through and then get you to the point where I can make a recommendation and I can say, this is what you need to do about Medicare for you and your spouse. So with that, I'm Hans Scheil.
And I'm Tom Griffith.
And we thank you for listening.
Thank you.